Oh, it's not already 11 now.
Yeah, it's preparing to live stream, setting up your meeting for YouTube Live. Just a few seconds, maybe. Yeah.
ये हो गया क्योंकि लाइव ऑन यूट्यूब आ रहा है.
Yeah.
Are we good?
Yes, I think we are good.
Okay.
But Shahid. Okay.
बस वो म्यूट ऑल का उसमें चले जाएं. We should start now. So intro.
You can start, Shahid.
Okay, so let me first do the mute all thing.
Yeah.
So just for everyone's information, inshallah, we'll be starting soon. So we will be putting everybody on mute and then we'll start the program, inshallah. Okay, any of the co-hosts, if they want to speak, they can always turn their mic on. Okay, we can start the program, inshallah. We'll start with the tilawat al-Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. من الشيطان الرجيم بسم الله الرحمن الرحيم ألم نشرح لك صدرك ورفعنا ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع الأسر يسرا إن مع الأسر يسرا فإذا فرغت فانصب وإلى ربك فارغب صدق الله العظيم. أعوذ بالله من الشيطان بسم الله الرحمن الرحيم. We will start the program, inshallah. I'll just go over a few housekeeping information. So first of all, if everyone, as you're aware, we will put everybody on mute, but you will have the option of asking any questions in the chat. And the chat is monitored by Kashan. So feel free to put your comments and questions on the chat. Secondly, you can adjust your view. We had some questions last webinar where individuals, some of them, if you're not very familiar with Zoom, you can always click where the speakers are, and then you can toggle between the screens. So adjust whatever you feel like. You can have an option of multiple people on the screen as icons, or you can have just a speaker view. And also, as always, we welcome your feedback and let us know how it goes. And use the chat option. With that, turn over to our president, Nazli Khan.
Assalamu alaikum, everyone. Thank you, Shahid, for the details. First of all, I would like to thank all of the participants. How many we are right now? 32. That's good. I'm sure you guys don't want to miss this very important topic of today. Just want to give you a little bit background of this topic or this webinar. We had a survey a few months ago, I think last year, and just to get the information from our members that what are their interests and what they're looking for. So many of them were looking for some health tips during this unprecedented time. So we decided to just change a mood, and instead of having any technical webinar this time, let's give some health tips to our members. As you all know that we have a very wide variety of membership of different ages, and it's always good to prevent some of the health issues before it get worse. So, and luckily we have a very talented, very knowledgeable doctor in our circle. She's the daughter of our NEDAC member. Most of you know Kareen Bhai, Shah Kareen, who is I think NEDAC member since its inception. I don't want to go into details of her credits or awards because for that I have Adnan. I just want to thank Dr. Shahla for spare some time and to be with us today. She is not in Toronto, she's in US, but luckily she found some time for us to be with us today. Thank you, and over to you, Adnan.
Thank you very much, Nazli. Assalamu alaikum, everyone. This is Ahmad here. So today we have with us, as mentioned by Nazli, Dr. Shahla Ahmad. She's a board certified physician in North America. Her area of specialization is geriatric and palliative medicine. She was born and raised in Canada, so I have to go through little details about her before she started her presentation. She has completed her residency in geriatric and palliative medicine at Penn State University. She's a fellow for geriatric medicine at University of Buffalo Jacob School. And beside those ones, there's a list of awards she has in her name. That's the first one was in 2017 when she was awarded with Joseph P. Baring Award for Outstanding Physician. Then secondly, he was awarded with the Outstanding Fellow by the State University of New York, Jacob School of Business. So without going into much details, I would like Dr. Shahla Ahmad to start her presentation on prevention of frailty. So please, it's over to Dr. Shahla Ahmad. Dr. Shahla.
Shahla, you can unmute yourself. Yeah.
Walaikum
assalam.
Okay, wonderful, wonderful. Thank you so much. So I'm going to just start off by sharing the screen. Can you hear me well?
Yes, we can.
Okay, perfect. Let's share the screen. Please let me know if you are able to see it.
Yes, we are.
Make it full size. Okay, perfect. Can everybody see it?
Yes.
Okay, wonderful. Assalamu alaikum, everybody. It's thank you so much for the very warm welcome and the introduction. It's really a pleasure to be here today and to share some of my knowledge and expertise with all of you. Ideally, I would have really enjoyed having this lecture, this conversation with you guys in person. But unfortunately, we have to do it over Zoom. I really love interacting with people and imparting some of my knowledge. So it will be my humble request that if you are able to, only able to, please turn on your camera so this can be more of an interactive session. And I'm going to request that I have your undivided attention because some of the information I'm about to share with you all today is very invaluable, but it is the information that I share with my patients on a daily basis in my clinic and in the hospital setting. And so I'm glad to be able to share all of that with you today as well. I want to start off very briefly. I know the introduction was already given, but I want to start very briefly talking about the scope of medicine that I practice. So as you know, I am an American and Canadian board certified physician in both family medicine, but I also have additional certification now in geriatric medicine as well. After I completed my residency, I spent a great amount of time practicing broad spectrum primary care. And so what that means is it included everything: pediatric care, adolescent care, women's health, gynecological care, mental health, sports medicine, dermatological procedures, preventative medicine, but most importantly, chronic disease management and geriatric medicine. In working very closely with my patients, I always found my senior patients to be the most complex, but at the same time, the most neglected. And surprisingly, this was also the area where I felt that the smallest things that I did for them, or that we did for them as a team, had the most greatest impact when it came to their care. And so I felt that, this was the area that I needed to focus the most. And I felt that if you could make changes much, much earlier on, you could see a dramatic difference in the future. I would often find children coming into the clinic with their parents saying that, you know what, my mom and dad's health is deteriorating. They're not doing the same things that they used to be able to do before. I would have senior patients coming into my office in their 50s, 60s, 70s, telling me that, I'm not the same person anymore. I can't do the same things that I used to be able to do, say, 5 years ago or 10 years ago. And that's very challenging. So after 4 years of practice in primary care, I decided to go back to medical school and then complete my geriatric and palliative fellowship at the University of Buffalo. And believe it or not, I did this fellowship at the peak of COVID, when COVID hit. And I worked as a fellow hospitalist with some of the most sickest patients, I tell you, the most vulnerable patients, most complex geriatric cases that you could ever imagine. These were patients with terminal illnesses, cancers, COVID. And for some, with the grace of God, we were able to get them back to health. But for some of them, I had to transition them to their end stages of life, which was very difficult. But in working so closely with these elderly and senior patients, I would often ask them one important question. And that question was, what mattered to them the most? And I ask you the same question as well. What matters the most to you in your life? And different things for different people, right? Different things matter for different people. We all place our importances in different areas. But the one thing that always came up was not about living a long life. Nobody wanted to live a long life, but they rather wanted to have a life with quality. So quality of life was the most important thing. And for many here today, if I ask you the same question, I guarantee there will be a general consensus that quality of life is the most important thing. And for many, that means being strong, being healthy, and maintaining that independence till the very end of your life. Nobody wants to be dependent, right? So I think quality of life means giving patients that ability to live with dignity till the very end. And that's what we want for our parents. That's what we want for our loved ones. And that is what we want, of course, for ourselves. So when NEDAC contacted me and asked me if I would be able to present to the members, I decided to bring forward the topic that I felt would be the most impactful. I've given this lecture several times, maybe 20 plus, to residents, to fellows, to my medical students, to people from all walks of life. And I'm so happy that I'm able to share this with you today. And I'm hoping that after today, you'll be able to take some tools from my lecture to implement into your life today and even starting tomorrow. And so that's my goal here today. So today we're going to be talking about one of the primary geriatric syndromes called Frailty, okay, which impacts almost every senior, I think, to some degree. And it's the leading cause of illness, in my opinion. And it's the leading cause of mortality as well. This is just a quick medical disclaimer for all of you. This is not intended for medical advice, diagnosis, or treatment. Always consult your physician, of course, if you have any healthcare related needs or concerns, okay? Again, we talked about what matters most, right? Which is quality of life. So let's talk about frailty, because I feel like this is a topic that is not very well understood by people. And I'm going to coin the topic very well for you all today. So first of all, leading contributor to functional decline, mortality in both Canada and US by far, okay? It's a medical condition where we see reduced function and reduced health in older individuals at varying different degrees, of course. This is the most important part. So when you are frail, your body does not have that capacity, that ability to cope with minor illnesses that you normally would be able to do if you were healthier. That's what frailty is, your physiological reserve. to cope with any kind of health stressor that impacts you. And finally, frailty can begin before the age of 65. I tend to see it 65 plus, but 70 plus is when it really, really starts to escalate. So look at this, over 1.6 million Canadians living with frailty. That's a lot. And if you really come down to the calculation, that's 1 in 4 people in Canada have frailty. And that's projected to increase to 2.5 million in 2030. That's huge, right? About 3.7 of Canadian caregivers are dedicated to caring for those elderly patients who have frailty, and that is projected to increase to 7.5 million in 2040. That's incredible. So what are the features of frailty? And so when we go through this, I'm sure there'll be many who have seen this in their parents. You may have even seen some of these subtle changes in yourself as well, and that's very important to recognize. So usually there will be 3 or more symptoms that travel together. And that is unintentional weight loss, 10 or more pounds within the last year, muscle loss and weakness, feeling very tired, slow, and sluggish, noticing that your walking speed is slowing down, you're not as fast as you used to be, and low levels of physical activity. If you have 3 or more, you fall into the frailty category right away. So this is very, very important to recognize. The sad part, in my opinion, is many people feel like this label is very embarrassing and shameful. You know, you go to your doctor's office, your doctor deals with the acute issue at hand, but they don't address the elephant in the room, which is the fact that the patient is frail. And so that's often missed. And so many people are very uncomfortable talking about a topic such as this because they think, oh, this only happens at the end of life. It shouldn't be happening right now. Right? Many feel like it's just a part of natural aging, so we should not address it at all. But the reality is, the truth is that frailty actually puts you at risk for several health complications and problems. And so this is a very limited list of what frailty can cause: weight loss, delirium, which is confusion, falls, recurrent hospitalizations, malnutrition, polypharmacy, disability, institutionalization, and of course, the big one, which is mortality, right? And so the good news, though, is that regardless of where you are on that frailty spectrum, because frailty truly is a spectrum, you do have some control and you do have the chance to prevent frailty and even reverse some of that risk. My thing is, the sooner you begin, the better. And that's why we really need to be willing to have these conversations, both as patients, but also as physicians. We need to be able to have these conversations. And that's why we're here today, so I can have this conversation with all of you. So let's first talk about what frailty really is. I want you to envision frailty as a dynamic entity. And I'm going to really drive the home point with this slide. This is my favorite slide of the whole PowerPoint presentation. And I really want to describe the cascade of functional decline. Most of the times, people will start off at the first stage here, as you can see, where you are robust, where you are strong, you know, and then something will happen. A patient will endure some sort of a stressor that will allow you to dip in that functional capacity. That stressor can be something as simple as getting COVID, having a fall, and for many, as we've seen, getting cancer, diagnosis of cancer, and then undergoing chemotherapy. What really happens, though, is when you go through that stressor, your body tries to recover, as you can see, but you never fully recover back to your original baseline. And that's where the problem happens. We want to recover to where we were before, but you never really come back to that original baseline. And so in doing so, you are already slightly weak, you're already slightly compromised. And we know that when somebody is sick, usually other issues come along as well, right? One sickness leads to another sickness to another sickness. And then you undergo another stressor. And that stressor causes hospitalization. It causes polypharmacy, where doctors add a bunch of medications that have side effects. You become bedbound, and then again, you try to recover, but you never fully go back to your baseline. And what ends up happening is that those stressors can build a heavy load and make that journey back to recovery even more difficult as you go down that cascade. And eventually what we see is people become frail, which is the stage right here, disabled, and that disability eventually leads to mortality, which is death, right? The good news is that this is a spectrum. And there are several things that you can actually do to reverse frailty. And that's what we're going to be talking about today. I want to drive a point home a little bit more strongly. So this picture right here, and we have permission from the patient to show it to you. This patient right here was one of our patients in her 60s, one of my patients, who was actually in very good health, was doing very well. Unfortunately, was diagnosed with breast cancer, and then underwent a mastectomy and some pretty aggressive chemotherapy. Unfortunately, the side effects of chemo, as you all know, is weight loss. She developed poor nutrition, several hospitalizations. She was coming into the hospital every single month, maybe every bi-weekly because of chemo side effects. She became bedbound, she became weak. She went from 130 pounds to 89 pounds, tremendous amount of weight loss, as you can imagine, in a span of just a few months. So the question I ask you is, would you consider this patient frail? Absolutely. She is frail. And imagine if you or I, in our state of health right now, were able to get the cold or a flu, say we got COVID, most likely we have the strength and the physiological reserve to come back to health, to recover. Imagine this patient right now in this state of health at around 89 pounds, with all those comorbidities that I discussed with you just previously. Do you think she would be able to endure an additional stressor, such as the flu? What if she got COVID in the hospital? What if she got a pneumonia? Her body and her physiological reserve to push her back to recovery is very limited. And most likely this patient would become very sick. She might end up on life support and she may not be able to come out of it. And so is it important for her to use the preventative measures to reverse some of that frailty? Absolutely. And those are some of the things that I did discuss with her, and she's doing much better now. Therefore, my point now is the decisions that we make today while we are healthy on a daily basis is what is going to impact how we do over the next several years. But the point is you need to start now while you're healthy, not when you are frail and not when you are pre-frail, and definitely not when you're disabled, okay? So how do we prevent frailty, right? That's the bread and butter. That's why we're all here today, right? So let's talk about methods on how to prevent frailty. The key is to recognize it early. And we talked about some of the features of frailty, but I want to talk about a few other things that I discuss with my patients. So these are key things such as difficulty opening a jar lid. You know, I noticed that with my patients that they can't open up a lid anymore, or difficulty carrying heavy groceries, difficulty standing up after sitting down, unable to cross the street fast enough. So you notice that the light's turning yellow and red and you've just slowed down, or needing to take frequent breaks in between your activities compared to before because you don't have the energy. These are the very, very subtle early signs of frailty. And if those are setting in, or sorry, pre-frailty actually, if those are setting in, this is the time to take action. Once you recognize the signs, you can really start to reduce that frailty load. I call it the frailty load, okay? And these are, again, conversations and management plans that I discuss with my patients on a daily basis. And I use something called the AVOID algorithm. And believe it or not, the AVOID algorithm was created by the Canadian Frailty Network. It's a beautiful algorithm that summarizes all of the things that I discussed with my patients. So we're going to go through that one by one. And I'm going to spend a good amount of time trying to explain to you how to implement these things into your life immediately. The first thing is activity. And I'm sure you're looking at this picture and you're wondering, who's that handsome man on the elliptical machine? That is my dad. My dad will tell you, I make sure he exercises every day. That does not mean that I follow him to the gym every day. It just so happened that we both ended up at the gym at the same time, and I saw him on the elliptical and I was very happy with him. So that's my dad, exercising. So let's talk about activity, right? So the best way to stay mobile and strong and healthy is to do activity, activity, activity. You must strengthen your muscles. You must get your heart beating, right? It's never too late to start. I always tell my patients, motion is lotion. And the best analogy I can give you is if you take a car and you park your car in the garage for 3 years, 2 years even, that car is going to rust. Your body is the same way. Your body rusts as well. So when you don't move, your rust are things like osteoarthritis, osteoporosis, weakening of your muscles, weakening of your bones, weakening of your joints. So the question is, Dr. Ahmad, is any amount of movement good? Yes, any amount of movement is good. Move. Move every day. And I'm not talking about moving from the kitchen to the sofa, to the living room, to the bathroom. No, dedicated amount of time where you do consistent amount of movement at any pace. So the questions that people ask me are, okay, well, Dr. Ahmad, what kind of exercise should I be doing? And how much should I be doing? And what type of exercise should I be doing, right? The first type of exercise is aerobic exercise, which is endurance activities. This increases your endurance, your ability, your endurance. And these are exercises that get your heart pumping, so it can supply oxygen to all of your organs. It involves repetitive activity where you're using the large muscles of your group. So what are those muscles? Your biceps, your triceps, your leg muscles, your hamstrings, your quadriceps, your gastrocnemius, your soleus. These are your large muscles. And this can be any type of repetitive exercise. So whether it be elliptical, whether it be the treadmill, whether it be jogging, whether it be something as simple as pushing the lawnmower, that's also cardio exercise. It's endurance exercise. And if you can't do any of these things, walk, just walk, plain old simple walk at any pace. The key is to do at least 20 to 30 minutes a day. That is a must. 20 to 30 minutes a day. And I try to say, if you can, moderate intensity, something that makes you sweat a little and gets your heart rate up a little. That's very important. The second type of exercise, which I think is overlooked all the time, is strength training. And strength training basically works on the integrity of your muscles and your bone. It strengthens your muscles, it strengthens your bones. And basically, strength exercise is basically making your muscles do more work than what they're used to doing. So for my mother and for my father, it's as simple as them lifting dumbbells every day. My mom lifts about 2 to 5 pounds in a day because, you know, that's what she's comfortable doing, but that's some sort of a resistance training. You can get those tension bands and hook it up somewhere and do resistance training with those bands. You can do it within the comfort of your own home. You don't need to go to the gym. So when my father goes to exercise, he does a combination of both. He'll do 20 to 30 minutes of aerobic exercise, and then he'll do maybe 5 to 10 minutes of resistance training or strength training. And believe it or not, there is just so much in the literature about how exercise can slow down frailty, but even reverse frailty if you do it on a consistent basis. You want to start doing this when you're healthy, not when you're pre-frail, not when you're disabled, right? The next big point is vaccination. That's me at the Brampton Brampton Embassy Convention Center doing the COVID vaccines that we had going on the last couple of months. And why is vaccination so important? So as we age, our body's immune function does decrease, and our ability to fight off infection is reduced. So vaccines are actually safe and effective. I always tell this to my patient. I don't force my patients, but I tell them get vaccinated. This improves your ability to resist infectious diseases and severe complications from infectious diseases that can cause hospitalization and then poor health. We just talked about the fact of hospitalization, right? You don't want to get hospitalized. It causes frailty. So you don't want to get these infectious diseases. So my recommendation is all my adult patients, especially 65 and above, should be getting the high dose flu vaccine, the quadrivalent high dose flu vaccine annually. There's no question about it. If you ask me, I support it. It's always risk versus benefit, right? And the benefits by far supersede the risks. The other vaccination that I strongly advocate for is the shingles vaccine. For most of you who know or who don't know, shingles is a very painful rash that you can develop later on in life as a sequelae of the chicken pox that you get when you're a kid. And that rash is very painful, and the pain that you endure from that rash is lifelong for a lot of my patients. So the shingles vaccine reduces that by 99%. That's huge. And that can start at the age of 50. Pneumonia vaccine for all my patients who are above 65. And pneumonia, the incidence of pneumonia has reduced significantly after getting the pneumonia vaccine. So also, the other one I forgot to mention is your tetanus shot. Your tetanus shot should be updated every 10 years. So today in Canada, we know less than 5% of people die from infectious diseases, 5%. And thanks to the invention of vaccines. 100 years ago, infectious diseases was actually the leading cause of death worldwide. So we've come a really far way with vaccinations. Make sure you get vaccinated, okay? The next big point that I want to drive home is your medications, okay? It is a fact that as the number of medications increase on your list, the list of harmful effects like the drug interactions and hospitalizations increase. So the first thing I do with my patients when they walk in with their like loot bag of medications is I go through all of their medications, right? Do you know that 1 in 4 Canadians above the age of 65 have at least 10 different medications on their list? And that's the minimum. I see people walking in with 30, 35, 40 medications on their list. It's insane. And I tell my patients, and I tell you as well today, when you see your healthcare provider, have them review all of your medications. Harmful side effects for the geriatric patients and senior patients include confusion, malnutrition, falls, dizziness, and that's just to name a few. So as that list increases, your side effects from these medications increase, your risk of frailty becomes even higher. So when you see your doctor, ask these 4 questions. Number 1, why are you, and this is your right, by the way, why are you taking these medications to begin with? Like, what's the reason for each medication? A lot of my patients don't even know why they're taking them. They're just popping them like candy and they don't know why. What is the proper way to take your medication? What are the possible side effects of each medication? Because it's possible that you're going through something and you just don't realize that it's a side effect of the medication you're taking. I've caught it multiple times. And the last question is, how will you know if the medication is working? Because if the medication is not working, then you shouldn't be on it. It's as simple as that. The 4th point, which again, I mean, I feel like this is downplayed a lot, is, interaction. And in older adults, believe it or not, loneliness and social isolation is a real thing. Nobody wants to talk about it. And it's been associated with 45% increase in death. That's huge. And now research is showing that loneliness, isolation, and depression is now being associated with potentially life-shortening health issues. These are things like high blood pressure, heart disease, depression, dementia, obesity, mortality, all of these things linked to isolation. So I am a big advocate for making sure that my elderly have some sort of an outlet, some sort of a social interaction or relationships. It doesn't have to be with a lot of people. It could be your loved ones. And if you don't even have that, then, I have patients that are going out to community centers, are volunteering, but some sort of interaction is extremely imperative to maintain your physical integrity and also to prevent frailty. It's huge and it's overlooked a lot. The last point that I want to drive home is diet and nutrition. I'm going to spend a great amount of time here. I'm going to talk to you about the practical approaches that I discuss with my patients, and then I'm going to talk about the few things that I've implemented into my own parents' life. So you can see how I've practically applied this into our lives as well. That's my mom in the garden collecting tomatoes from last year. This year it's not been so great, but yeah, so that's her in the garden. So let's talk a little bit about nutrition. The first thing is there's just so much literature, so much evidence-based medicine, and so much research here. So there's no doubt in terms of the benefits of some of the things I'm going to discuss. As we age, we need more protein. Your body's muscles are all made of protein. And so protein helps to maintain muscle mass. It helps to keep us healthy. And there are a tremendous amount of good sources of protein. So what are those sources? Chicken, hopefully grass-fed chicken, eggs, fish, milk, nuts, beans, lentils, Greek yogurt. But the question is, how much protein is enough, right? Because we all think that we're eating a good amount of protein, but how much protein is enough? You'll be surprised to know. So the literature says expert recommendations are 1 to 1.5 grams per kilogram. That's a lot. So just to give you an idea, if you weigh, say 80 kilograms, that's about, I think, 175 pounds. That's 1 gram per kilogram. That's 80 to 120 grams per day. How do you consume that amount of protein? To be very honest, it's very difficult. So if you're in your 20s and 30s, I mean, you sustain your muscle mass, you're fine. Once you start dipping into the 60s and 70s, it's hard to maintain that level of muscle mass. And especially for somebody like my mother and my father, and my mother especially, as you know, for her post-cancer survivorship, one of the things that I was really worried about is how do I regain some of her muscle mass? And so more than a physician, I learned a lot about nutrition, taking care of my mom as a daughter. And so one of the things that I did was, even just in speaking with several different nutritionists at North York General Hospital, at Princess Margaret, Bene Protein is one of those clean sources of protein. And there's other ones out there too, but this is the one that I used. And this is amazing because it's a very tiny scoop that packs 6 grams of protein in a scoop. It's flavorless, it's light, and you can add it to anything. Your smoothies, your drinks, your water, your soups, your chicken curries, your whatever, your coffee in the morning, and you won't even feel it, and it's there to give you that sustenance, right? So do I want you to go for natural sources of protein? Absolutely. Do I think you're getting enough from those natural sources of protein? Maybe not, because we know that as we age, we have some decreased appetite as well. Our body doesn't crave food as much. And so this is just such a phenomenal way to add protein supplementation into your diet. Going back, let's talk about calcium, right? I'm sure you've heard of it. Oh, so such and such is taking a calcium supplement. Your doctor is recommending a calcium supplement, but why, right? Do you know that calcium is the most abundant mineral in your body? Over 99% of your body's calcium supply is found in your bones and in your teeth. And that supports the structure of your body. It's important for muscle function, strong bones, nerve transmission, hormonal secretion, and it helps to prevent osteoporosis. That's a lot. So should you be consuming calcium from your diet? Sure, but we don't get enough. And so calcium supplementation, I strongly encourage it for my pre-frail and frail patients. You can take it even if you're healthy. Usually the recommendation for men, 51 to 75 is 1,000 milligrams a day. For women, 50 to 71, because women have estrogen deficiency as well, it's 1,200 milligrams a day. And for all of my patients 70 and above, I say take at least 1,200 milligrams in a day. It's vital. It's vital to take this. So talk to your doctor about this. See if you qualify to be on a calcium supplement, okay? The next thing I want to talk about is vitamin D. We've all heard about vitamin D. Vitamin D is linked to everything. The benefits of vitamin D are abundant, right? We think, and we've heard, oh, well, you know, diet and sunlight. Well, how much sunlight do we really get in Canada, right? 75% of Canadians are vitamin D deficient. It's as simple as that. Anybody I check in Canada for vitamin D, everybody has vitamin D deficiency. I have vitamin D deficiency, right? So vitamin D has a lot of benefits, but the big one is it is imperative, particularly for bone health. And there are an abundance of studies that say vitamin D deficiency increases your risk for falls. So for all of my geriatric patients, I have them on vitamin D. I have them on vitamin D, whether it be a loading dose or whether it be a maintenance dose, need to be on vitamin D. Do I think you're getting enough from the milk and the cheese? And I mean, it's great. I want you to include that from the broccoli. Maybe not, and most likely not. So I would strongly recommend you talk to your doctors, your parents' doctors about vitamin D supplementation. Usually the dose that I recommend is 1,000 to 2,000 international units daily. If you are deficient, I will put you on 50,000 a week for a small amount of time, and then put you on the regular dose, which is 1,000 to 2,000 daily. Both of my parents take it, I take it. My husband takes it. So let's go to the last point, which I think you all are just going to love. These are these are ways that I've implemented these nutritional points into my parents' diet. As most of you know, I come home every week to 2 weeks to see my parents with my husband. And whenever we come, it's like a tradition. We make these 2 things for my parents and for ourselves. So the first thing are the power soups. And if you guys want to learn, this is not my invention. These are just things that I have accumulated over the years in caring for my mother and father and reading books and talking to nutritionists and of course doing my own study as a physician. If you want to learn more about it, I'll briefly describe it to you, but CarmenCares.com is a website that I created for my brother, and it has a lot of health benefits on it. So you can learn about how to create this soup. It is very simple. Choose any vegetable of your choice, any vegetable. They all have nutrition, minerals, nutrients that are beneficial for anyone. And then choose any spices, seeds that you want. It's your choice, but usually I'll include things like flax seeds, hemp seeds, which are very high in omega-3, anti-inflammatory. Oats are a great source of protein. We know this, right? Put your oats in your soup, yes. Black seed. I mean, we've heard about the black seed, right? And the benefits, even in the Quran, right? The black seed. Strongly anti-inflammatory, strongly anti-cancer, right? And then turmeric, haldi, right? Turmeric. Turmeric is strongly antimicrobial, strongly anti-inflammatory. You can add this to anything, subtle amounts. You won't even feel it in there. And black pepper, of course, is needed to help with the absorption of turmeric. Mix everything together, add some water, add some tomato sauce, it's done. And so the simmering of all of these ingredients allows those nutrients to dissolve into the liquid, into the broth. And the broth is just so nutritious. Easy to make. We make it once a week. You can do it yourself. Second thing that I want to talk about is something that we all know about. Dr. Ahmad, this is not your invention. It's not my invention. It's the invention of our grandparents and great-great-grandparents. But we've all heard about this magical concoction called yakhni, right? Bone broth. We all know about this, right? We make it for our sick ones, our loved ones when they're not feeling well. But this should be, I think, a staple in our diet on a regular basis because the benefits are just huge. So yakhni, as you know, is made by simmering bones of any meat for a long period of time. They say sometimes even 8 hours. But the key here is what makes this broth very magical is that the bones themselves, the marrow in the bone, releases certain high density minerals. And these are things like calcium, phosphorus, magnesium. We know those are staples for bone strength and joint strength, right? And then yakhni also has amino acids, which are protein products needed for muscle strength. And it also releases collagen and glucosamine, which improves joint flexibility. So we make this like once a week. The reason why I've included these two things is I also want you to see that aside from just the medical advice that I'm giving you, I've also implemented this into my parents' life on a bi-weekly basis. And it's something that I'm doing practically as well. And it's doable, it's feasible for anybody. And it's a nutritious meal for any member of the family. You don't need to be 65 and above to enjoy this, right? I want to talk about the last slide. And I was contemplating about whether I wanted to include this or not. I wanted to end on a very high note, but I think that this part of the lecture is, in my opinion, the most important. This is where my bread and butter of medicine lies. Alhamdulillah, all of you guys here today are healthy. You're all doing well, which is great. The reality of the fact is, though, unfortunately, there are going to be people in our family, like our parents, maybe our loved ones, maybe our aunts and uncles who are not robust. They're not even pre-frail. There may be people at the very end of that spectrum who are disabled and who are extremely frail and not doing very well. And this is the reality of life. As difficult as this conversation is, it is a reality of life. There is a group of like-minded physicians, including myself, very experienced in their field, who ask the question about whether aggressive surgical intervention, advanced cardiac life support, like putting a breathing tube, doing CPR on patients, feeding tubes, aggressive procedures, is the goal really to treat, or actually are they doing more harm to the patient? That's the question. So are these treatments actually helping the patient? Or are these treatments actually hurting the patient? Is the chemotherapy that they're giving to this 98-year-old female who has a weight of almost 70 pounds going to help her? Or is it going to eventually kill her because of the side effects? And this is a very important question, right? To ask your parents or your patients or your loved ones. These are conversations that I already at this stage have with my parents, and my parents are doing fine. But the key is that we want to treat, but you don't want to do harm. And you don't want to have these conversations with your loved ones when they can't speak for themselves. That's the hardest position to be in, to try to care for a loved one when they can't speak for themselves, to try to make decisions for a loved one when they can't. So a lot of my patients who are extremely disabled and frail, they say, Dr. Ahmad, if something were to happen to me, let me go naturally. Please don't put me through aggressive measures that are going to cause me pain and suffering. And that for them, believe it or not, is quality of life. Being able to be with their family members, being able to be out of the hospitals, and not being put on artificial life support. And so I really wanted to drive that point home. I'm going to end the lecture by thanking you guys so much. I love to end with my favorite quote, which is basically, an ounce of prevention is worth a pound of cure, really. An ounce of prevention is worth a pound of cure. And like I said before, what we do today, what you take from the lecture today and what you start doing today on a consistent daily basis is really what's going to impact the years ahead. It's going to impact your 60s, your 70s, your 80s, your 90s, your 100s, your 120s, maybe your 150s, right? Inshallah. So I hope you guys enjoyed it. With that, I'm going to conclude the lecture. Thank you so much. I'm open to answering any questions, of course. And I'm curious to see, you know, how you guys found the lecture and what are some of the things you think you'll take away from this. Thank you so much.
Adnan, do you want to unmute your mic and start taking questions? Thank you.
Yes, please go ahead. I think Kashan is here because he's ready to take the questions.
Oh, I see.
Anyone who wants to ask anything from our presenter, please.
Yeah, so I think the questions are coming on the chat. So if you can.
Yeah, they can put their questions on the chat. So we'll get the answers from Dr. Shahla. Dr. Shahla is mute.
I think there's one question that I see, very great question from Khalid Nazim. So are there any advice on people in their 50s to start doing now? Great question. Wonderful question. So absolutely. Everything that I mentioned to you right now, I would advise you to start doing in your 50s. There's this mindset that, oh, well, we'll only start doing these things when we're in our 60s or in our 70s, or when we become pre-frail or frail, and that's when we're going to start taking action. I can tell you, my parents started doing a lot of these interventions in their 40s and their 50s, and now going into their 60s. So no, it's never too early to start. Every single pointer that we mentioned from the avoid algorithm, you should start doing now. So that means exercising, implementing nutrition, making sure that there's no polypharmacy going on with your medications, making sure you get vaccinated. So absolutely, great. So what is the role of multivitamins? Great question. Multivitamins are generally for general health prophylaxis. You can take them on a daily basis for prevention, right? My thought process is that, you know, nothing beats natural remedies, right? And so if you can get your vitamins from the natural sources, and that's why I talked to you about the bone broth and the soups, because those are the natural sources, that's probably more beneficial. Because a lot of these vitamins have other chemicals added in them as well. We don't know what the long-term side effects of those are. And so I always tell my patients, try to start with natural sources first. But if you go to your doctor and you're having symptoms and you find that you're deficient in vitamin D, or you're deficient in vitamin B12, or you're deficient in calcium, that's when sometimes the regular multivitamins don't have enough of the sustenance to bring those levels up. And then you need to go on therapeutic vitamins to bring those levels up. So I hope that answers your question. Are we allowed to allow people to ask questions in person, or just to make it a little bit more interactive? If people want to raise their hand. Yes. So great question. People having D3 tablets, do they need calcium in addition? Yeah. In order for proper absorption of vitamin D and calcium, the both need to be taken together, because one supports the absorption of the other. So you definitely want to take both together. Yeah, I don't know if, oh, there's some hands. So
I want to go with some questions from our, how to control PP without medicine. There's a question from Mr. Sharif.
That's a good question, not related to this topic, but that's okay. So essential hypertension or high blood pressure is defined as a blood pressure greater than 130/90, right? We know that. And we know that the blood pressures, once they start going above 130/90, have tremendous impact on your cardiovascular system, causing heart attack and stroke and kidney disease, right? There are natural ways to reduce your blood pressure. For example, trying to reduce your salt. We know this for a fact. Salt reduction weight loss, because weight is highly linked to high blood pressure. High blood pressure and weight go hand in hand. It's so significant that when my patients lose about 5 to 10 pounds, I notice their blood pressure goes down. So highly linked. And of course, trying to avoid processed foods and walking and exercising on a daily basis. But that being said, I do want to drive home the point that in some cases, high blood pressure is genetic. It's genetic. And as you age, your vessels do start to harden. And so that causes high blood pressure in itself, right? And so when it comes to a point where all of your natural interventions are not working and you've got a genetic history of high blood pressure from your parents or your grandparents, or you're aging and you just have got chronic high blood pressure, in some cases, then you need to be put on medication because nothing else is working. And that's usually a last resort for my patients.
Hi, Shahla.
Ji,
Can you hear me?
Yes.
Sorry, we had some technical difficulty. I wasn't able to unmute myself. I want to thank
no
you
problem.
first before going for question answer. And I think, Adnan, are you taking the questions or Kashan?
So I would make a recommendation for anybody who is raising their hand, if we can kindly unmute them one by one and allow them to speak, that would be great. Just if we're able to, if the host is able to do that.
जी अस्सलाम वालेकुम मैं ख्याल है मैं अनम्यूट हूँ अरशद नाम
जी जी
अरशद भाई।
ठीक है बहुत ग्रेट प्रेजेंटेशन डॉक्टर अहमद बहुत
Thank
मजा
you.
आया आपकी बातें सुन के एक क्वेश्चन है आपने यखनी का बताया उस बारे में एक मेरी बात हुई एक मेरे कंसल्टेंट फिजिशियन है और उन्होंने ये कहा कि आप ये चीज कभी भी ना लें वेरी डिफरेंट ऑफ ओपिनियन जैसा आपने बताया उन्होंने कहा कि इसके अंदर बोन मैरो के अंदर बहुत सारी ऐसी चीजें होती हैं जो कि बॉडी के लिए बहुत हार्मफुल है एंड नोबडी शुड यूज दोस थिंग्स सो क्वेश्चन इज के मतलब आपकी ओपिनियन डिफरेंट है और एक कंसल्टिंग आर्थराइटिस स्पेशलिस्ट वो ये बात कह रहे हैं तो कौन सी बात मानी जाए
There will always be a difference of opinion amongst physicians. You go to any physician with any kind of a chronic illness or any kind of an acute illness, there will always be physicians within the same expertise that will have differences of opinion. For example, some physicians say that patients who are diabetics and who have heart disease, should be taking aspirin. Some physicians say, no, aspirin has a high risk of bleeding. Don't take that medication, right? Some physicians say that patients with diabetes should be on cholesterol-reducing medications. Some physicians say, no, you don't need to be on cholesterol-reducing medications because cholesterol-reducing medications cause muscle aches and pains and other side effects. So there will always be a difference of opinion, and no patient is ever the same. What you need to see, I believe, is whether that remedy is conducive to your personal health or not. Look and read and see what the literature says in terms of support of using that remedy or not. That's very important to look at the literature, and you will find different things, but you have to see what works best for you. And so the bone broth as well, like I was talking about, there are some great benefits of that. We know that there's some great literature on that as well. But at the same time, it may not be very good for somebody who is using, the proteins that you get that are genetically modified or that are infused with all sorts of different chemicals and GMOs and stuff like that. At the same time, maybe a cancer patient may not benefit from the marrow ingredients that are coming from the bone. But from what I've read, from the literature that I've read, and I've been reading for quite some time, the benefits are huge. I still recommend that you consult with your doctor so they can go through your medical history and see if it's beneficial to you or not.
Thank you.
Oh, my pleasure.
Dr. Sahib, there's another question from for you. It's 1 second. Where it is?
I think there is asking to be unmuted.
Yes, somebody is asking for the unmuted. The effect of calcium on liver health. Somebody is asking you for the effect of calcium on liver health.
So I'm not 100% sure about that question, and I'll be very honest with you. I don't know. I do know for a fact, though, that any supplement that you take, medication-wise, all medications, most medications are filtered either through the liver or through the kidney, right? So we know that. So if you've got a history of liver disease or liver toxicity from before, it may not be good to take some of these supplements. Again, a great question for, your hepatologist who's managing your care. As far as I know, calcium does not have a harmful effect on the liver, but it is cleared through the liver. I think
question,
Sharif uncle has his hand up.
Yes, please.
I love the questions. I love the questions.
Adnan, unmute Sharif bhai,
Just a second. Right here.
or I can do
I
that.
already unmute Shahid.
Sharif bhai. I can't find it. Okay. Sharif bhai, you can unmute yourself.
अस्सलाम वालेकुम डॉक्टर साहब, आपके प्रेजेंटेशन बहुत ही अच्छी है, बहुत ही मालूमात प्रोवाइड कर रही है। अब मेरा एक छोटा सा सवाल है, अभी आपने कहा कि प्रोटीन्स के लिए आपने कुछ चीज़ें बताई कि वो रेगुलर इस्तेमाल करें, फॉर एग्जांपल एग। नाउ आई यूजुअली टेक 2 eggs in the morning, but I'm being warned by some other doctor that इसमें जो yolk है वो उसमें बहुत high level of cholesterol होता है, that increases your cholesterol, so you better try to avoid taking the eggs. What would you say on that?
You know, what's really interesting is, thank you so much for the feedback. My dad asked me the same question. My dad asked me the same question yesterday. And again, I'm going to go back to the same thing, is there's conflicting information on both sides. Eggs, ki aapko pata hai, eggs, the nutritional benefits of eggs are huge. The choline, the protein, the vitamin D there's so many good things, so many good benefits of eggs, right? And so again, conflicting information as well. There are studies that say that the egg white and the egg yolk has no impact, or the egg yolk specifically has no impact on the cholesterol, does not increase your risk of cardiovascular disease. And then there's conflicting information from the American Heart Association that says that yes, it does, but you have to take it in moderation. To be very honest, I'm going to tell you my thought on this. First of all, if you go to your doctor and your doctor tells you, look, you've got hyperlipidemia, you've got dyslipidemia, your LDL is high, your total cholesterol is high. In that situation, I would say to exercise a little bit of caution, right? If your cholesterol levels are absolutely normal, then in that situation, I would not deprive yourself from a nutritious food. Everything should be done in moderation though, right? And so if you want to have your egg a couple of times a week, have it every week. But if you're having 3 eggs every morning, like my dad was, I'm going to tell him, no, you got to cut down a little bit and maybe go to maybe once every couple of weeks, right? And so, or a few times a week. So my advice to all of my patients is everything in moderation. But if you truly have a cardiovascular risk factor like hyperlipidemia, diabetes, and high blood pressure, you want to cut down your amount on eggs, because we know that eggs do contain cholesterol, right?
आपने अभी एक और बात कही, आपने कहा कि ट्राइग्लिसराइड्स रिड्यूस करने के लिए मेडिसिन नहीं लेनी चाहिए, जैसे जो एक मेडिसिन आती है. तो I'm a little bit confused on that, because I have been given I have higher triglycerides. I've been given this medicine.
So no, I didn't say that. Triglycerides is a different type of cholesterol. I was talking about LDL and total cholesterol. Triglycerides is a different type of cholesterol. And when your triglycerides start going above 300, wow, you better be on medication, right? But triglycerides are solely driven by high sugar diet and lack of exercise. That's a different type of cholesterol altogether. And so I tell my patients before I put them on triglyceride reducing medication to first start a regimented exercise program first, and to cut out all sugary processed foods from their diet. And most of the times I find that it works like a charm. So that's a different type of cholesterol. Thank you so much.
Can I ask a question now?
Assalamu alaikum.
Walaikum salam, Shahla beta.
How are you?
I hope you recognize me. It was an excellent presentation, and may Allah bless you, keep you healthy all the time. A quick question. There was a little bit of a technical problem. I missed some part of your diet thing. There is a big thing going on about plant-based diet and avoid dairy completely to reduce the inflammation in the body. Any thoughts on that? And people are going crazy on that.
Wow, you're going to get me in trouble because I have a lot of thoughts on that. But to be very honest, Uncle, the thing is that the protein supplementation that you get from certain foods. Remember, back in the day, our ancestors used to eat meats and berries and vegetables, right? Unfortunately, the amount of protein and the quality of protein that you get from meat is much different than what it is from vegetables. And we know that. And so people who cut out meat completely from their diet, I'm not opposed to that because meat does have harmful effects. Meat can cause inflammation. Certain types of meat can be linked to certain types of cancer as well. So yes, but at the same time, it goes back to the same question that the other member was asking. And that is that, do we completely cut things out from our diet? I think everything in healthy moderation is very, very important because they do have their benefits. Remember, meat helps to support brain health. Meat helps to support muscle function and health. And the amount of protein that you get from meat is much, much more than you can get from any vegetable source. So for my vegetarians and vegans and all the pescatarians and no, well, not pescatarians, but my vegetarians and my vegans, I tell them that's fine, but then you need to supplement with protein in some way or form. And whether that be with, a protein powder source or whether that be with protein tablets, but nothing beats the natural sources. We know this, right? So yeah, that will be my answer.
Hi, Dr. Ahmad. Thank you very much, Khalid here. Excellent presentation.
Thank you.
Very relevant. My parents are in their 80s and I'm in my 50s. And so everything that you have said is very relevant. One question on social aspect of how to manage this. Have you seen or do you feel it's a good thing to have a group approach to implementing these changes? We create a group and we drive people as a group towards achieving these goals, Any thoughts on that? Or is it an individual? You think it's more individual?
No, I agree with you, actually. This is my bread and butter when it comes to caring for patients who are 80s, 90s, palliative. I can't even tell you some of my patient encounters, even in the clinic, will go for an hour and 30 minutes. And the reason why is because, and I'll answer your question, and I'm sure you'll agree, caring for an elderly is, as much as we love our parents, it's cumbersome. It burns you out. It's not easy. And unfortunately, it does come to a point where caregivers do burn out and their ability to provide becomes limited because you're so burnt out yourself that you cannot provide for your loved one. And so my approach is actually a multifactorial approach. And when I see that caregivers are burning out, and I see it a lot, I usually recommend either higher level of care, and we don't do that for our parents, right? Like we're not going to ship our parents off to a nursing home. That's awful, right? But sometimes you're in a situation where if say your mother or father has dementia or Parkinson's, or now, they're completely bedridden, it becomes almost impossible to take care of these patients at home. And so trying to get into some sort of a group home or assisted living where you can get the support of nurses, physical therapists, nutritionists, occupational therapists, or even visiting nursing services at the home through Lincare or whatever. In Canada, it's Lincare. But that is highly, highly, highly recommended. A lot of people are opposed to that. I will tell you that I strongly support it. I fill out the applications for my patients all the time. And for patients who want to keep their parents at home, there are avenues in the Canadian healthcare system. They're not the best, but they're there to get help into the home. And I strongly recommend that to prevent caregiver burnout. It's a huge thing. It's a big thing.
Thank you, Shahla. Is this my turn to say something?
Sure.
Because yes, I was the first one to raise my hand. I was not getting the chance. Anyways, guys, I just want to make a few comments from my experience. And of course, you saw some slides, like Shahla showed me on the slide and everything. So of course, I have some experience and I would like to say a few things and just for the benefits of all the audience and everything. Before Shahla became a doctor, I always took interest in a medical subject. I don't know why. And that's the reason, like in my office also, people call me resident doctor. I don't know the ABC of the medicine or anything. But anyways, after Shahla became the doctor, I had, a very healthy and long conversation on the medical subjects and everything. I take interest very much. Anyway, the reality is that we are all aging and we cannot stop and reverse it. That's the reality. Personally, I think aging is beautiful. It's beautiful. It's beautiful like, like a green leaf turning into golden and the red. Look at the beauty of the nature. So everything in nature that ages, and that's so are we aging. And that's why the phrase is aging gracefully. So we would like to age gracefully, And to do that, of course, what we don't want, and actually XYZ, so many people I have talked to and asked, what they all said is that they don't want any pain, any suffering, any dependency or anything. They want to be independent. They want to do their own chore on themselves, by themselves or something like that. So that's our wish. And the term Shahla used is the motion is lotion. Of course, I mean, WD, the viscous object, the oil we put, to make the things running and everything. Similarly, that when we keep ourselves in motion, like whether we are walking, with resistance training and this and that, something I keep doing it. And of course, I'm benefiting from it. This is so important because you cannot get anything for free. You got to give your time and you got to be dedicated. You got to be doing those things, like you have to be very disciplined to do those things. And I do that. So this what I do. And I you know what? I was thinking like, for example, if we get normal flu or something like that, and we are bed bound even for 2 or 3 days, you will agree with me that then you cannot get up from your bed and start walking and everything. You get deconditioned. You get deconditioned so fast. So same thing happened there. You got to have a stored energy. And the most important part in your body, of course, Shahla knows better, more than your biceps and triceps and this and that, is your leg muscles. So if God forbid, if you get sick for any reason and you're bed bound for some time or something like that, the sooner you get up from your bed and you start walking or something like that, your healing process starts. And so that's why your leg muscles are extremely, extremely important. And, like I do these things and I recommend everybody to do the same thing. Thank you very much. Those are my comments.
Thank you, Karim bhai. There is a question, Shahla. Can you share your presentation? Even though we are recording it and it's going on live right now. Unmute yourself, please. Shall I unmute yourself?
Yeah, can you hear me?
Yeah.
Okay, perfect. Let me see how to do this again. Can you see my screen?
Yes, we can
Okay,
see.
perfect. Yes.
So you can share?
Yes.
Okay, so you can send me, no, they want to have a copy of your presentation.
Oh, okay, got you. Okay, absolutely, absolutely. My pleasure. I'll send that to you.
Okay, thank you.
No problem.
Any other question?
तनवीर भाई का क्वेश्चन है, वो पूछ लें तनवीर भाई, आप अनम्यूटेड हैं.
वो अनम्यूट है, इज अनम्यूट है तनवीर.
तनवीर भाई चले गए क्या?
One of the question था कि what happens with excessive protein consumption to avoid frailty?
What happens
when you're using the excessive protein with frailty?
Yeah, so like I said in my presentation, again, an excess of anything is not good, right? Protein is cleared through your kidneys. So high amounts of protein can lead to kidney failure. You have to be very careful with that, which is why a guideline was given from 1 to 1.2 milligrams per kilogram, right?
Yeah.
But high amounts of protein consumption are very dangerous. It can lead to kidney failure. And this is something that I discuss with a lot of my patients who are bodybuilders, and they consume high amounts of protein on a daily basis. So again, everything in moderation, of course, but studies have shown, the American Geriatric Association has shown that with frail patients and pre-frail patients who are losing muscle mass, protein supplementation helps to strengthen those muscles and prevent some of and reverse and prevent some of that frailty that can develop as a consequence of that.
Thank you.
Any other question?
तनवीर भाई कह रहे हैं वो अनम्यूट नहीं है.
अभी
तो अनम्यूट कर रहा है उनका यहाँ पे.
तनवीर भाई आप खुद ही अनम्यूट करें अपने आप.
I am unmuted. Can I say a few words?
Absolutely. Always. Assalamu alaikum, uncle.
Walaikum salam. It was a very nice presentation you did, and we took so many. It was full of all kinds of information we need to know. We probably know some of it, but it's always nice to have somebody remind you and put you and direct you in the right direction, and some confusions which you cleared. So I'm very happy and pleased that I joined this session. So
I'm so happy that you were able to join as well.
Yeah,
It,
no,
it-
it
it
was
gives me an
wonderful.
immense amount of pleasure to know that, members of NEDAC, but extended family members and friends benefit from this information.
And the sister, she asked about that your presentation. Can we get a copy of that? That was very nice. I was thinking about it, but I wasn't sure whether you would like to share that.
Absolutely,
Or
that will be
give
my
it first.
pleasure. And from what I understand, the presentation will be shared as well, so everyone will have
That's great.
access to it. Yeah.
That's great. So may Allah bless you. Okay.
Jazakallah khair. I appreciate the feedback.
Yeah. So I have to leave now. And assalamu alaikum, everyone, and good wishes. Okay.
Thank you.
Good
Thank you. There is a question.
I have
may I have a question?
Yes, sure.
Khalid bhai, just a second. There is a question in the chat box. Let me ask that. And then
Okay.
Khalid Hassan.
Okay.
Salma Shakil ne pucha hai, how much water to drink daily to avoid kidney failure type thing?
Great question. I'll be very honest. You may have heard from people in the literature, maybe if some doctors tell you 7 to 8 glasses of water a day. I disagree with that. One of my colleagues, who is a nephrologist, a kidney doctor, told me and explained to me that what he tells his patients is, and so by the way, 7 to 8 glasses of water a day is great. If you can get that, that's awesome. But he told me that a good way of knowing that your body and your kidneys are being well hydrated is to, unfortunately, not to be too descriptive, but is to look at the color of your urine. And so people who are very dehydrated will have orange, dark colored urine. People who are well hydrated will have light colored urine. And that's a good sign of hydration. Looking at your skin turgor, right? So if you notice that your skin is very dry, very wrinkly, and this is aside from, of course, changes that you get with aging, the chances are is that you're not very well hydrated, right? If your doctor is having difficulty getting blood from you, chances are you're not very well hydrated. If you've got dry mucous membranes, chances are you're not very well hydrated. And so there's signs and symptoms in your body that will indicate to you that you're not getting enough water. Now, that being said, great question, because not everybody should be drinking a lot of water. And so for people who already have kidney failure and who are on dialysis, and for patients who have congestive heart failure, where their heart is not pumping a subsequent amount of blood into the body, they're at very high risk from developing fluid overload status, which is fluid in the lungs and fluid in the body, because your body can't filter it out. And in those cases, there are different guidelines in terms of how much water you should be taking. I hope that helps.
Yeah. Khalid?
Jay, my question, I don't know, maybe it's related or not, but important part here, apart from the people, those are really conscious about their health and they are aware of it, that they want to address all these issues. There are few people, maybe I said most of the people are affected by this stress, and they are demoted, they are not, so how you can see that emotional or motivational things to do to bring them on that,
and we didn't talk about this part in the lecture. Great question too. We didn't talk about this question about this aspect in the lecture just because of time purposes. But the reality of the fact is we talked about physical frailty, right? Physical frailty.
Right.
There's a such thing as cognitive frailty as well, and that's where a lot of my research lies as well. Your cognitive status really impacts your physical status. It does. They're highly, highly linked.
Right.
And so if you are suffering from depression, anxiety, PTSD, trauma, whatever it may be, the first step is to, I think, even before physical activity, is to take care of your mental health first. And that's a whole other lecture in itself. I'd be happy to talk about it in the future sometime, but mental health is a key component, as we talked about it, right? Mental health can affect your cardiovascular system. It can affect your livelihood. It can cause frailty. And so talking to your doctor about ways to manage your stress is very important. De-stressing is going to be and for some people, de-stressing is very hard. Eliminating any kind of unnecessary distractions from your life that are not conducive to your health is very important. So for several of my patients, I talk about detaching from social media, detaching from relationships that are causing them stress, getting proper sleep at night. That's a huge thing that causes depression, right? And doing some kind of movement, because we know that even just walking or movement decreases your risk of depression and mental health related issues. So the answer to your question is the two are very, very connected. Is it the chicken or the egg? It's hard to know, but they both are very, very connected. And you need to take care of, I think, the mental health aspect first before you can really start to take care of your overall health.
Yeah,
Good question.
That's what I was, you did not address. So I intentionally put this one because there are a lot of people those that cannot actually express it and they don't want to, but there are people those are affecting, having the effect on in their life through these things, and they don't even realize that they're passing through that situation.
Absolutely.
That's what need to be addressed as well.
Absolutely.
Analysis.
We couldn't get into too much detail, but when my patients come in frail, when I see that they're scoring very high on their frail scale, the first thing that I look at is to see if they're depressed.
Yeah.
And as part of their depression workup, I do some blood work. I check to make sure that there's no underlying metabolic disorders that are causing their depression. And for some of my patients, I even start them on medication. I think somebody is unmuted. Hold on a second. Yeah. So, and for some of my patients, I even start them on medication because it's necessary. It's necessary to get them to that point where they can be physically active.
Yeah. Okay. Thank you.
Thank you. Thank you.
I found Shahla, exercise is a very good tool to de-stress yourself.
100%.
That's very well connected.
Shahla, I don't want to belabor the subject, but some of the medical professionals are proclaiming that inflammation is the root cause of all the problems. And you really have to go through diet, through medication. Any suggestive help as to how we can reduce the inflammation while we are aging?
100%. I have one suggestion for you only. I make it very easy for my patients, and I agree with you. I mean, is inflammation truly the root cause of many problems? Well, we see it, right? We see that the incidence of cancer has gone up. We see that the incidence of diabetes, heart disease, stroke, heart attack being one of the leading causes of death in America and US has gone up. We see more sicker people in the population. And it begs the question of whether our lifestyle choices are affecting our internal health. And I agree with you. I think our diet has a huge part to play. Unfortunately, the food industry is $1 billion industry that manipulates foods in ways that even we can't control. And so my general advice to patients is make it very simple for yourself. If you are holding a food product in your hand, and that food product is coming from a man-made source, the chances are that that's bad for you. All you've got to do is flip over the package. My parents will tell you my husband will tell you that's all I do. In every grocery store, I'm flipping over the packages and looking at the ingredients. It takes 2 seconds. And if you see anything on there that does not sound like a food and is a chemical, the chances are that it's causing some sort of an effect on your body from an inflammatory and oxidative standpoint. Yes. Free radicals, oxidative stress cause cancer, they cause inflammation, they cause all sorts of cardiovascular disease. And so if you hold a food in your hand and that is a man-made food, whether it be, I don't know, I'm trying to think of whether it be like, those granola bars or whether it be anything that's packaged, it's probably bad for you. But if you hold that food and it's coming from a natural source, so whether it be lean protein, grass-fed chicken, whether it be fruits and vegetables, whether it be whole wheat, unprocessed flour, those are probably better for you than the processed and man-made foods. It's as simple as that. You keep it simple. And of course, there's only so much we can control, right? Because it's like, okay, well, are these fruits really organic or not? And this and that. The best thing I think would be to live on a farm, have your own chickens, have your own cows, and plant your own vegetables. And that would be like the ideal dream life, honestly, if we could do that. Like our parents and our forefathers used to do back in the day. But unfortunately, we don't have that ability here. And so we still have to make wise choices and right decisions for ourselves. And that's why I showed you those 2 different types of soups, because they all come from natural sources. They're very easy to make,
Shahla, एक सवाल और है मेरा वो
Sharif bhai, can we get from Mr. Dhira Kantia? I heard that he has a question. क्योंकि आप already
okay, no problem.
Just after him, okay?
There's one more question. There is a raised hand from Kafi Imran.
Mr. Dhira, can you unmute yourself?
Hari, can you listen?
जी,
जी Thank you, Dr. Shahla, for sharing your time.
You're
I have
very welcome.
two questions. I joined a couple of minutes late, maybe, so I don't know whether you had defined what's frailty. What do you mean? What's definition and how? I don't know whether you had defined and how, because, for example, in my case, for example, I feel my veins are visible. You can see the weight is less than what's the regular weight. So how do you define the frailty? That's my one first question. Second question.
No problem. No problem. I actually did define it. It's a very hard concept to define, but it's not as difficult to understand as you can imagine, right? And so I did talk about it in the beginning, but the best way to describe frailty, in my opinion, is your body's internal physiological reserve, your ability, your strength to fight off any stressor that affects your body is considered to be frailty. So that's all it is. So for example, somebody in their 20s, somebody's in their 90s. Somebody in their 20s gets COVID. Their ability, their body's inner reserve to fight off that stressor is much more robust than, say, somebody who is in their 90s and has already endured physical weakness, malnutrition, weight loss, and some physical debility. That person in their 90s will have a harder time combating an illness because they don't have that physiological reserve. That is the definition of frailty.
So basically you're saying that it's not basic, it's not a very dependent on weight and visible, how people look like visible.
It is. It is dependent
more
on
like
that. It is dependent on that.
Inherent qualities, inherent strength, and so probably you answered. Second, my question is regarding, although you partly define, I am vegetarian basically, and so you said that the protein should be used, so like in a form of some, you gave a name, something like that. Would you further elaborate, because in diet and relative, although you showed it something, but if you have a minute, you can further elaborate. That's what I'm saying.
It's a general.
Your voice is not.
No, we don't hear you. Sorry.
Oh, can you hear me now?
No, yeah, it's okay.
Yeah, now it's okay.
Well, I think it's a general consensus, and we know that vegetarians are very healthy. It's a great lifestyle, but there's a general consensus, and we know this, and I know this because I do serological blood work on my patients who are vegetarian, that there is a risk for vitamin B12 deficiency. There's a risk for protein and malnutrition as well, of course. Remember, a vegetarian who's in their 20s and 30s and 40s and 50s may not have the same degree of protein deficiency that somebody for somebody in their 80s or 90s, right? There's a difference in that, on that gradient. The supplementation, again, I strongly advise that you talk to your doctor about it, because I don't know what your underlying medical conditions are, whether protein supplementation is safe for you or not. But the general consensus for my patients who are pre-frail and frail is, if you can't get enough protein from your diet, which most of the times you can't even get it from a diet with meat in it, is to take some sort of a protein supplementation, something that will give your muscles that nourishment that you need, that 1 to 1.5 grams per kilogram of protein that you need on a daily basis. And even then, many times that protein requirement is not met. So to answer your question, I think supplementation is a great way to go, but you have to talk to your doctor to make sure that it's safe for you to take it.
Thank you. Thank you. I appreciate your time.
Pleasure. My pleasure.
There is another question from.
Can we ask Afia?
Yes, please. Can you unmute yourself? Because I already asked everybody to unmute by their own.
Can you hear me?
Yes, we can.
Assalamu alaikum. Shahla, how are you? I'm good. Great to see you here, and an amazing presentation. I would definitely say that NEDAC brought a very good, a completely different perspective, and we all know that we are in that stage of life where we need all these great suggestions by you. So Shahla, my question to you is that when we're talking about diet, and right now you mentioned granola bars with whole wheat, there's a whole new thing about gluten. and the wheat. And our South Asian diet is absolutely filled with wheat, right? We're all about the rotis and the naans and everything. So what is your take on gluten? And my second question would be the kind of fats, canola oil or coconut oil,
yeah,
or margarine or butter or desi ghee, because right now all the new thing is golden butter, which is actually desi ghee. So what do you suggest? Because there's so much out there.
I know there's so much out there.
Confusion.
Honestly, Afia, we could have like a 2-hour long conversation on this because there's so much out there, right? Like, I agree with you. But just to make it very simple and short, again, I think there are a lot of my patients that have gastrointestinal diseases and illnesses that sometimes are unexplainable. And there are a lot of people out there that do have celiac disease and gluten insensitivity. For those patients who have IBS, that's irritable bowel syndrome, by the way, is gluten insensitivity, celiac disease, and we test for those things. If you've got those issues, then you do want to stay clear of gluten. But at the same time, Afia, I would say, unfortunately, the alternatives to gluten are also very dangerous as well, because they're very chemically packed and they're very processed and modified, like I was explaining to the other uncle, right? So you have to be very careful about substitutes. But in general, if you don't have any gut insensitivities, you want to be able to still, it's all about balance, right? And so you don't want to completely remove whole wheat from your diet as well. It has its benefits as well. And so I say, if you can find a clean source of organic whole wheat atta, so flour, I think you're good to go. And then of course, everything in moderation. White wheat, rice, pasta, white pasta. And unfortunately, these are all highly inflammatory. And as the other member was saying, inflammation definitely has a high risk of complications such as cancer, such as cardiovascular disease, and many other things, because it's oxidative stress. So you have to be very careful. So my thought process is go for the natural foods, go for foods in their most natural form. Even if you're buying your wheat, make sure, if you're buying your bread, make sure that it is sprouted whole wheat bread. And that's what you should be going for. And that's what we go for as well. Similarly, when it comes to oils, there is no question about it in the literature. Vegetable oils are highly processed, omega-6, inflammatory rich products that, in my opinion, can lead to inflammation, oxidative stress, cancer, cardiovascular disease. I generally, looking at the literature, will recommend that you try to stay away from seed oils and vegetable oils. They're dangerous. They're highly processed. And what you want to look for, again, is cold pressed. And we can talk about this for hours, so I'm just gonna make it simple, but cold pressed extra virgin olive oil. Again, there is limitations to that too in terms of what cooking point. Avocado oil, coconut oil, pure desi ghee. These are better alternatives because they have the right omega-3 to omega-6 ratio. I'm sorry?
No, somebody else is here.
Oh yeah, these are highly processed oils, and so you want to try to stick to the ones that are higher in omega-6 and less anti-inflammatory. So those are things, like I said, olive oil, coconut oil is great. Sometimes it has a bad flavor to it, and of course, what do you call it? Avocado oil. And many physicians and nutritionists have said that ghee is fine too. You have to watch, of course, your cholesterol intake with those ones, right? So that would be my answer in a nutshell.
All right. Thank you so much.
You're very welcome. Great question, by the way.
Adnan, do we have more question in the chat?
Actually, Sharif Bhai wants to ask another question. So, Sharif Bhai?
And I think we can, I think this will be our last question. And then
अच्छा, ये डायरेक्टली रिलेटेड क्वेश्चन नहीं है, मैं सिर्फ ये पूछना चाहता हूँ, अभी आपने शैला आपने कहा जैसे फूड है, $1 billion इंडस्ट्री है, इसी तरह फार्मास्यूटिकल जो है ये भी एक मल्टी बिलियन डॉलर इंडस्ट्री है. तो जो व्हाट आई हर्ड इज दैट द स्टैंडर्ड्स फॉर द ब्लड प्रेशर व्हिच हैव बीन सेट कि 130/80 होना चाहिए, 140/80 होना चाहिए, ये एक्चुअली इन लोगों ने सेट किए हैं ताकि मेडिसिन ज्यादा से ज्यादा बिके. व्हाट वुड यू से ऑन दैट? थैंक यू.
Again, a very complicated question. And yes, the pharmaceutical companies are $1 billion industry, but at the same time, we know that certain blood pressures above a certain range do cause cardiovascular risk factors. We see it in our patients as well, right? So you can't mess up the statistics, and the statistics still are statistics still show that heart disease and stroke are the leading causes of death in America and Canada. And we know that heart attack and stroke are caused by smoking, high cholesterol, diabetes, and high blood pressure. There's no question about it, right? And we know that regardless of whether you want to set that point to 120 over 80 or 130 over 90 or 140 over 90, after some point, that high level of pressure on those small micro vessels is causing some level of damage. We know it, right? Your kidneys have the smallest vessels. You take a hose and you try to pump that level of pressure in a small straw, that straw is going to rupture. And the same thing happens with high blood pressure. It causes stroke, it causes heart attack, it causes kidney failure. So I always say err on the side of caution. Prevention is very important. Try the natural remedies first to lower your blood pressures. And so by the ways, I just want to say there are 5 or 6 different guidelines about what appropriate blood pressure should be. Sprint guideline says less than 120 over 80. I'm forgetting the name. The American Heart Association says less than 130 over 90. And then there's the JNC says less than 130 over 90. There's different recommendations. So what do you go by, right? I look at the risk factors. And if you have high risk factors in combination and you have a high risk for heart attack and stroke, I will try to do lifestyle. And if lifestyle is not working, I will put the patients on medication. But the general consensus is 120 by 80 is the normal blood pressure. Once you start going into 130 over 90, you're on stage 1 hypertension. You're stage 1 hypertension already. So hopefully that answers your question. Today, I feel like I have, mashallah, 48 patients at once.
At once. It's so interesting, Shahla. आप बात करती रहो, हम सुनते रहें, लेकिन but we have a limitation on our time. So I think on behalf of NEDAC and all of our participants, I really like to thank you for taking time out and giving us so much important information, which is of course helpful for ourselves, for our parents, and for our loved ones. My mother is 81 years old and I'm right now taking care of her. So this is really very helpful.
Thank you so much. I want to commend you for taking the initiative and coming up with the concept of inviting me to the NEDAC community. I'm very loyal to the community because of my father, and it's very, very nice to see that I'm able to divulge some of that information to the members today. So like I said, if any of you benefited from this, please keep us in your du'as. Please keep me in your du'as. Please keep my parents in your du'as. And, and please start implementing these things into your life. That will mean a lot.
Thank you, Shahla. And if anybody wants to connect with you, can we pass it on your contact info to them? Because I'm sure people will ask me after this presentation.
Yeah, I mean, if you want to accumulate a list of questions, you can do that. Okay. And that would be the easiest way. I have so much going on my phone and my email, so it's sometimes very hard to manage.
No, definitely.
But yeah, absolutely. They can direct the questions to you, and that would be great.
Yes.
Yeah.
Okay. Thank you.
Thank you, guys.
Thank you very much. Thank you, everyone.
Thank you.
Thank you.
Thank you, all the participants.
Thank you, Karim.
Thank you. It was a great presentation, and thank you very much for everyone and for Dr. Shahla as well. Thank you.
My pleasure. My pleasure. Thank you very much. Thank you.
Thank you.
Yeah.